I want you to do something before I say another word. If you're sitting right now, and it's safe to do so, I want you to stand up from your chair without using your hands. Don't push off the armrests. Don't grip the table. Just stand. And while you're doing it, pay attention to 4 things. How fast you came up. Whether you felt steady or a little wobbly at the top. Whether your breath caught, even slightly. And whether anything in your chest felt tight, fluttery, or just off. Then sit back down, slowly. Now think about what you noticed. Because whatever you just felt in those 3 or 4 seconds, that wasn't nothing. That was your heart talking, your blood pressure talking, your leg circulation talking, your nervous system talking, all at once, in a language most people never learn to read. Doctors have known about this for a long time. Cardiologists use it, physical therapists use it, geriatric specialists use a version of it in almost every assessment for adults over 65. There are studies going back decades linking the way an older adult rises from a chair to their risk of falls, hospitalizations, heart events, and even how many years of independent living they have left. That's not an exaggeration, that's in the research. And yet, if you're like most Americans over the age of 55, no doctor has ever asked you to do it in their office. Not once. You've had your blood pressure checked sitting down. You've had blood drawn. You've had an EKG while lying flat on a table. But nobody has watched you actually stand up. The one moment of the day when your heart has to prove it can still do its job under pressure. That's what this video is about. Because here's what most people get wrong. They think a slow, effortful stand-up is just aging, just stiffness, just the knees, just being tired that day. And sometimes, yes, that's exactly what it is. But sometimes it's the earliest, quietest sign that something inside is not keeping up anymore. And I don't say that to scare you. I say it because the earlier you notice it, the more you can do about it. The people who catch this early tend to do very well. The people who dismiss it for years, those are the ones who end up in an emergency room wondering how they didn't see it coming. So the goal today isn't panic, it's pattern recognition. It's learning to read a signal your body has been sending you every single day, probably for years, that nobody ever explained. By the end of this video, you're going to know exactly what a healthy stand-up looks like. You're going to know the 5 specific warning signs that matter. You're going to know the one habit almost every senior does in the morning that turns a small warning into a real emergency. And you're going to know how to make your own stand-up stronger, safer, and more reliable, without a gym, without equipment, and without leaving the room you're in right now. But before any of that, we have to answer a question that bothers me every time I think about it. If this test is so simple, so revealing, and so well known in medicine, why has almost no doctor ever asked you to do it? The answer is not what you'd expect. Here's something that took me a long time to understand. When you go to your doctor's office for a checkup, almost everything they measure is measured while you are still. You sit down, they wrap the cuff around your arm. You sit down again for the blood draw. You lie flat on the table for the EKG. Even the stethoscope goes on your chest while you're perfectly at rest. Every single number in your chart, your blood pressure, your heart rate, your rhythm, is a number taken from a body that isn't doing anything. And that's the problem. Because a heart at rest is not the same heart that has to get you out of bed in the morning. A heart at rest is not the heart that has to carry you up the porch steps. A heart at rest is not the heart that has to fight gravity when you rise from a soft couch after dinner. Those are the moments when the heart is under load. And a heart under load tells the truth. A heart at rest can hide almost anything. Cardiologists have a phrase for this. They call it positional stress. It's the demand placed on your cardiovascular system the moment your body changes position, especially going from sitting to standing. In those first 10 seconds, your heart has to do something remarkable. It has to fight gravity, redirect blood upward against the pull of your own body weight, tighten thousands of tiny blood vessels in your legs, and adjust your blood pressure by the second so your brain doesn't lose oxygen. 10 seconds, that's the window. If the system is strong, you don't feel any of it. You just stand. If the system is struggling, even a little, those 10 seconds are when the cracks show. A brief dizziness, a blur in the vision, a wobble, a sudden tiredness that shouldn't be there, a flutter you dismiss, a shortness of breath you blame on the weather. These are not small things. These are the heart and the nervous system telling you they had to work harder than they used to just to get you upright. Now here's where I want to be careful with you, because if you're over 60, you might be sitting there thinking, I feel that every time I stand up, and I don't want you to assume the worst. What I want you to understand is that these signals are common, and that's exactly why they get dismissed. Common doesn't mean normal. Common doesn't mean safe. Common just means shared. And in this case, it's shared by millions of Americans who all assume the same thing you might be assuming right now. that it's just age. The reason your doctor doesn't catch it is not because they're careless. It's because the appointment isn't designed to catch it. 15 minutes, seated measurements, a rushed conversation. There's no time for a load test. There's no time to watch you stand 3 times and time the first 10 seconds. So the signal passes through the visit invisibly, year after year, until something bigger forces it into view. That's why this matters. You are the only person who sees your stand-up every single day. You are the only one who can catch the change early. But to catch it, you need to know exactly what your heart is doing in those first few seconds, and what's going wrong when the stand-up feels harder than it should. Let me walk you through what happens in your body between the moment you decide to stand up and the moment you're fully upright. It takes less than 3 seconds, but inside those 3 seconds, there's an entire chain reaction that most people have no idea is happening. The instant you rise, gravity does something almost unfair to you. Roughly a pint of your blood, some estimates say closer to 2 cups, gets pulled downward into your legs and your belly. Just like that. Gone from the upper body. That's blood your brain needs. That's blood your heart needs to pump back out. And if nothing corrected for it, you would faint every single time you stood up. So your body has a rescue system, and it's beautiful when it works. The moment you stand, tiny sensors in your neck and chest called baroreceptors feel the drop in pressure. They fire a signal to your brainstem in a fraction of a second. Your brainstem shouts back down through your nervous system, telling the blood vessels in your legs to squeeze tight, telling your heart to beat a little faster, and telling your body to push blood back up toward your head. All of this is supposed to happen in under a second. You never feel it. You just stand and go about your day. That's a healthy response. Now here's what happens when the system is slower than it used to be. The signal still fires, but the response is delayed, maybe by 2 seconds, maybe by 5, maybe by 10. And in that gap, that's when the system is slower than it used to be. 5, maybe by 10. And in that gap, that little window where your brain is briefly short on blood, you feel it. You feel the room tilt. You feel your vision go gray at the edges. You feel a strange lightness in your head. You reach for the counter. You steady yourself. You wait. And then it passes. And you go on with your morning. And you tell yourself it was nothing. Doctors have a name for that gap. They call it orthostatic hypotension, which is just a long way of saying your blood pressure drops when you change position, and your body isn't correcting for it fast enough. It becomes more common with every decade after 50, and it's one of the strongest predictors of falls in older adults that we have. But here's what almost nobody tells you. This response doesn't just get slower with age on its own. It gets slower because of things you might be doing every day without realizing it. Common blood pressure medications can blunt it. Diuretics, the water pills, can worsen it, especially in warm weather. Certain antidepressants slow it down. So do some prostate medications. So does dehydration, which is quiet and constant in older adults because the sense of thirst fades with age. Even a heavy meal can drop your blood pressure enough to make the next stand-up feel wrong. I'm not telling you to stop any medication, please don't. What I'm telling you is that if your stand-up has changed recently, if it feels different this year than last year, the reason is often sitting right there in your pill bottle, or your water intake, or the timing of your meals. And that leads to the real question. Because there isn't just one warning sign during a stand-up, there are 5. And each one points to something different going on inside you. I want you to picture yourself standing up from your favorite chair, the one you sit in every evening. Now I'm going to describe 5 different things that can happen during that stand-up. Some of them you'll recognize immediately. And when you do, I want you to pay close attention. Because each of these signs points to something different, and some of them matter more than others. The first sign is using your hands. If you can't stand up without pushing off the armrests, gripping the table, or planting your palms on your thighs and shoving yourself up, that's not just weak legs. That's a signal that the large muscles in your thighs and hips have quietly lost strength. And those muscles do more than move you. They pump blood back up toward your heart. Weak legs mean sluggish circulation, and sluggish circulation puts more work on the heart, every hour of every day. The second sign is the pause before you move. You know the one. You lean forward, you rock a little, you gather yourself for a second or two, then you go. Most people think of this as a habit. It's not a habit. It's your nervous system stalling because it knows the stand-up is going to be uncomfortable. It's your body bracing for the drop in blood pressure it's learned to expect. If you catch yourself pausing before you rise, your body is telling you it doesn't trust the next few seconds. The third sign is a rocking or swaying rise. A healthy stand-up is a straight line up. If you're weaving side to side on the way up, if you have to correct your balance halfway, if you sort of lurch to your feet, that's your inner ear, your leg muscles, and your blood pressure not coordinating cleanly anymore. In geriatric medicine, this is one of the earliest signs of increased fall risk. And falls in older adults are not small events. A single bad fall after 70 changes the entire trajectory of a person's life. The fourth sign is breath catching at the top. When you get to your feet and you notice a small gasp, a shortness, a sense that you need a bigger breath than the movement should have required, that is not a leg problem. That is a heart problem, or a lung problem, or both. Standing up is not aerobic exercise. It should not leave you needing air. If it does, your heart is working harder than it should to pump blood against gravity, or your lungs aren't keeping up with the demand. Neither of those things should be ignored. And the fifth sign, the one I want you to remember more than any other, is any sensation in your chest during or right after the stand. Tightness, pressure, a flutter, a skipped beat, a strange squeeze that lasts 2 seconds and then fades. People dismiss these constantly. They call it heartburn. They call it stress. They call it nothing. But a chest sensation that shows up specifically when you change position, that's a pattern, and patterns matter. It can point to valve strain, to a rhythm that's misfiring under load, or to arteries that can't deliver enough blood when the heart is asked to work harder. Now, one of these 5 signs is more dangerous than the others, and it's the one almost every senior in America dismisses as just getting older. The most dangerous sign is not the dramatic one. It's not the chest flutter. It's not the gasp for breath. Those get attention. Those get mentioned at the next doctor's visit. Those, at least, feel like something. The most dangerous sign is the quiet one. The one you've been doing for so long you don't even notice you're doing it anymore. It's the pause after you stand. You know exactly what I'm talking about. You rise from the chair, you get to your feet, and then, for 2 or 3 or 4 seconds, you just stand there. You don't walk. You hold the back of the chair, or the edge of the counter, or you just wait. Maybe your vision goes a little gray. Maybe the room drifts sideways for a moment. Maybe you feel a soft pressure at the top of your head, and then it clears, and you move on. Most people over 60 do this. Most of them have been doing it for years, and almost none of them have ever mentioned it to a doctor, because it doesn't feel like a symptom. It feels like a habit. It's not a habit. That pause is a blood pressure crash, a real one. Your systolic pressure, the top number, is dropping fast enough that your brain briefly isn't getting enough blood. Your body is buying itself time to catch up. And the reason I want you to take this seriously is because in the medical literature, this exact pattern, this brief drop when standing, is one of the strongest predictors we have of falls, hospital admissions, and cardiac events in adults over 65. Not one of many, one of the strongest. And here's what makes it worse. Most people don't even know they have it, because by the time they walk into the doctor's office, sit down, and get their blood pressure taken, everything looks fine on paper. The crash only happens during the transition, and nobody measures the transition. You can check for it at home, and it's simple. Sit quietly for 5 minutes. Take your blood pressure sitting down. Then stand up. Wait 1 minute. Take it again. If the top number drops by 20 points or more, or the bottom number drops by 10 or more, and especially if you feel dizzy while it happens, that's the pattern. Write it down. Bring the numbers to your doctor. Don't guess. Don't estimate. Numbers on paper get taken seriously in a way that descriptions do not. Now, I want to be careful here. A single reading doesn't diagnose anything. Blood pressure moves throughout the day. It's affected by heat, by hydration, by what you ate, by how you slept. What matters is the pattern. If you check it 3 or 4 times over a week and the drop keeps showing up, that's a real signal. And it's a signal your doctor can actually do something about. Sometimes just by adjusting the timing of a medication, or the dose, or by adding a little more salt and water to your day. But here's the part that keeps me up at night. Because even if you have this warning sign, there's a mistake almost every senior in America makes every single morning that turns this quiet drop into something much more dangerous. There are 4 moments in a senior's day when standing up is the most dangerous. And most people do all 4 of them without a second thought. The first is the morning. You've been lying flat for 6, 7, 8 hours. Your blood pressure has settled. Your body is dehydrated from the night. Your muscles are cold. And the very first thing most people do is throw the covers off, swing their legs over, and stand up in one motion to head to the bathroom. That single movement, that fast rise from a warm bed, is when more falls happen in adults over 65 than at any other time of day. The bathroom trip in the dark, the sudden stand, the crash of blood pressure, the reach for a wall that isn't there. It's a pattern emergency rooms see every morning of every week. The second is right after a meal. When you eat, especially a larger meal, your body sends a significant amount of blood to your stomach and intestines to help with digestion. That means less blood is available everywhere else. For about 30 to 60 minutes after eating, your blood pressure runs lower than usual. If you stand up quickly during that window, to clear the table, to answer the door, to head to the couch, you're standing on a system that's already running below its normal reserve. This is why so many older adults feel lightheaded after Sunday dinner and blame the food. It wasn't the food, it was the timing of the stand. The third is right after taking certain medications. Blood pressure pills, diuretics, some heart medications, and certain drugs for prostate issues all work by relaxing blood vessels or reducing fluid. That's what they're supposed to do. But it means that for the first hour or two after you take them, your blood pressure response to standing is weaker than usual. If your morning routine is pill, then stand, then walk, you're stacking risk on top of risk. And the fourth is standing up too fast, period. At any hour, from any chair. The fix for all four is the same, and it's almost embarrassingly simple. Any physical therapist who works with older adults will tell you the same sequence. Before you stand, sit on the edge of the chair or the bed for a slow count of 10. While you sit, pump your ankles up and down, flex your feet toward you, then point them away, 10 to 15 times. That single movement squeezes blood back up out of your legs and gives your heart a head start. Then rise slowly. Once you're up, stand still for another slow count of 10 before you take your first step. Feel your feet under you. Let your blood pressure settle. That's it. Sit 10, pump 10, stand 10. It sounds like nothing. In the research, it cuts fall risk substantially. It's the single easiest habit change I know of that protects a senior's heart and hips at the same time. Free, no equipment, no prescription, just 20 seconds of patience before the first step. Now, there's a way to make the stand-up itself stronger so you don't have to work around the weakness, you actually rebuild it. Here's the part I love about all of this. The chair test isn't just how you catch the problem. The chair test is also how you fix it. The same movement that reveals the weakness is the movement that rebuilds the strength. And I don't mean over years. I mean in a matter of weeks, if you do it right. Physical therapists have been using this with older patients for decades, and the results are consistent enough that it's now part of standard rehab protocols after hospital stays, hip surgeries, and cardiac events. It works because it trains all three systems at once: your leg muscles, your circulation, and your nervous system's ability to respond to position change. Here's how you do it. And please, if you have any doubt about your balance, do this near a sturdy chair or a wall you can grab. Start with a firm chair. Not a soft couch. A dining chair works well. Sit toward the front of the seat, feet flat on the floor, roughly hip-width apart. Bring your feet back so they're slightly under your knees, not out in front. That position alone puts you in a stronger place to rise. Now here's the key. You're going to stand up slowly, over about 3 seconds, and sit down even more slowly, over about 4 seconds. That slow lowering is where most of the strength gets built. It's called eccentric loading, and it's what your muscles adapt to fastest, especially in older adults. Breathe out as you stand. Breathe in as you lower. Don't hold your breath. Holding your breath spikes your blood pressure exactly when you don't want it spiking. Start with 5 of these. Just 5. That's it. If you can't do 5 without hands, use your hands lightly at first, and every week, try to use them a little less. Do this once in the morning and once in the evening. That's 10 total repetitions a day. It sounds like nothing. It isn't nothing. Within 2 weeks, most people notice the stand-up feels smoother. Within 4 to 6 weeks, many notice their balance is steadier when they walk. They're less winded on stairs. And, this is the one that surprises people, the lightheadedness when they stand up starts to fade. That's not a coincidence. You're literally training the reflex that was slowing down. Once 5 feels easy, go to 8, then 10. Don't rush. This is not a workout. This is medicine delivered through movement. A few honest cautions. If you have severe knee pain, recent surgery, or a heart condition that limits activity, talk to your doctor or a physical therapist before you start. If you feel any real chest pain, sharp dizziness, or nausea during it, stop. This is meant to build you up gently, not push you past your limits. But for most Americans over 55 sitting at home right now, this is one of the most powerful things you can do for your heart and your independence. It costs nothing. It takes 2 minutes, and it works. Even so, there are moments when the chair test isn't telling you to train. It's telling you to call your doctor, and you need to know the difference. Most of what we've talked about today is worth paying attention to over time. Track it, retest yourself, practice the sit to stand, see how it changes over a few weeks. But there are a few combinations that don't wait. They don't belong on the list for your next annual physical. They belong on a phone call this week. The first is dizziness combined with any chest sensation. If standing up leaves you lightheaded and you also feel tightness, pressure, a flutter, or a squeeze in your chest, even briefly, even once, that pairing matters. Alone, each one is common. Together, they suggest the heart is under real strain during the transition. That's a call to your doctor within days, not months. The second is shortness of breath combined with new swelling in the ankles or feet. If your stand-up leaves you winded and you've also noticed your socks leaving deep marks at the end of the day, or your shoes fitting tighter than they did a month ago, that's a pattern worth taking seriously. It can point to the heart not moving fluid the way it used to. Again, either sign alone might be nothing. The two together deserve attention. The third, and this is the one I want you to remember most, is a sudden change in your stand-up ability. If 6 months ago you rose from a chair without a thought, and today you have to push, pause, or gather yourself, that speed of change matters more than the symptom itself. Bodies change slowly. When they change quickly, something specific is usually driving it. A medication, a new heart issue, a rhythm problem, anemia. Something that a doctor can find if they know to look. When you call, don't downplay it. Don't say, "I've just been feeling a little off." Be specific. Tell them, "When I stand up from a chair, I feel dizzy, and it started about 3 weeks ago." Or, "I've noticed I have to use my hands to stand up now, and I didn't 6 months ago." Or, "I feel a flutter in my chest when I rise, and it lasts a few seconds." Specific language gets specific care. Vague language gets a vague appointment 3 months out. And ask them directly to check your blood pressure sitting and standing during the visit. It's called orthostatic vitals. It takes 5 minutes. Most offices don't do it unless you ask. Ask. The point of everything we've covered today is not to make you afraid of standing up. It's the opposite. It's to give you back a piece of information your body has been offering you for years, and to hand you the tools to do something with it. The chair test is 30 seconds. The training is 2 minutes a day. The awareness is free. One last reframe before we finish, and this is the one I hope you carry with you tomorrow morning. Here's what I want you to take from today. Your body has been talking to you. Every morning when you swing your legs off the bed, every evening when you rise from the dinner table, every time you get up from the couch to answer the door. In those 3 or 4 seconds, your heart, your blood pressure, your circulation, and your nervous system have been giving you a report card that no annual checkup can match. You just didn't have the language to read it before. Now you do. The way you stand up isn't about vanity. It isn't about proving you're still young. It's the single most honest window into how your cardiovascular system is holding up under real-world load. And unlike almost every other health test, this one costs nothing, takes half a minute, and you can run it as often as you like, in the privacy of your own living room. So here's what I'd ask of you. Tomorrow morning, before you get out of bed, sit on the edge for a slow count of 10. Pump your ankles. Then stand, slowly, and stand still for another count of 10 before you take your first step. That single change protects your heart and your hips at the same time. Once a week, sit in that firm chair and try the stand-up without your hands. Notice the 4 things: speed, steadiness, breath, chest. Write down anything that feels different than last week. Over months, that little log will tell you more about your health than most people ever learn about their own bodies. And if you have a spouse, a sibling, a friend, a parent, anyone over the age of 60 who matters to you, share this with them. Because the people who catch this early do very well, and the people who don't are the ones who wish someone had told them. Take care of yourself. Listen to what your body is trying to say, and I'll see you in the next one.